Alright guys, so to stay compliant with MyOSHA, the emergency rules, and to stay compliant with the CDC and the other guidelines for COVID-19, we have to create and instruct a COVID-19 training for our employees. So as you can see, this is going to be your COVID-19 training from Westmaas Electric. Alright, what this presentation will cover. So this presentation is going to cover workplace infectious control plan, or the policy, proper use of PPE, how to notify Westmaas Electric of any symptoms, close contacts, or even positive cases that you may have been involved with. What do you do if you're sick, and how to report any unsafe working conditions. So if you guys remember way back when this COVID-19 stuff began, I sent you guys out an email that had to do with two policies. One, actually both of them, in which you had to respond back saying that you read and you understood. One of those was the infectious control policy, or the infectious control plan. Basically, if you need a copy of this, if this is still not in your email, if you still need to access this, let me know. I will send you a new one. If for any reason you don't have it saved at all, and for some reason you need to see it, just like I said, let me know, and I'll be sure you get a copy. Proper use of PPE, or personal protective equipment. Basically what we're going to go over here is what kind of mask or face cover do I need, how do I properly wear the face cover or the mask, when am I supposed to wear my mask or face cover, and is there any other PPE that I can use to help protect myself against COVID-19? Alright, so continuing with the PPE, when selecting a mask or face cover, basically these little icons on the side are from the CDC, so they kind of help out. Do choose masks that have 2 or more layers of washable, breathable fabric, completely cover your nose and mouth, fit snugly against the sides of your face, and don't have any gaps like on the sides or anything like that. And then do not choose masks that are made out of fabric that makes it hard to breathe. So for example, like vinyl. Big thing that I didn't know was you can't have any masks that have any of the exhalation valves. So any like the workout masks, or certain N95 masks you can't have. Basically, if anything can escape out of your mask, you cannot wear it. Keep in mind, these masks are mainly to help you prevent spreading the disease if you have it. They can also help protect you from getting it. But if you have it and things are coming out through that porthole, there's really no sense in you wearing a mask. So keep that in mind. And then along with the N95s, we'll talk about that here shortly. N95s are not required to wear to help you prevent the coronavirus. So like I said, we'll talk about that here in just a minute. Some special situations. So if you have glasses, basically find a mask that will fit closely to your nose, or that has that wire that you can snugly put on the bridge of your nose there. That way it can prevent some fogging. You can use some tape sometimes too. If they're fogging up your safety glasses, let me know. I still have a couple pair of anti-fog safety glasses, and if I have to, I'll buy some more. They work tremendously. They've got the anti-fog on the front and on the outside, so please, if that's something you need, reach out. Gaiters and face shields. So the gaiter is the style that we basically supplied you guys in the beginning. If you're wearing a gaiter, it either needs to have two layers of thickness, which ours, I believe, are only 1. So you're going to have to fold that over as best as you can to cover up your nose and your mouth in order to actually wear that to prevent the virus the best way. And then there's a big caution with face shields. Face shields only really cover if you sneeze or something goes straight in front of you. Obviously, if you've ever worn a face shield, they're very wide open. So my thing is, and I think Westmaas's thing here is, if you're going to wear a face shield, you still need to wear a mask underneath it. So keep that in mind. Well, again, back to the N95 masks. Again, they're not required for you to wear, for us to wear, in order to fight against the coronavirus. Honestly, if you have a bunch of these and you're not using them, possibly think about donating them to like the hospitals and stuff like that. These medical staff need them really bad. But you guys need to keep in mind that these masks are also required for other things. So if you're working with silica dust, if you're working in an attic, anything with gases, dusts, mists, fumes, anything like that. By law, you guys have to be wearing these. So I still have a few left. If you have a few and you want to hold on to them, that's fine. Because when we come to a situation like this on your job site, you're gonna have to wear that still. That's still a citable offense if you're not. How to properly wear a face mask or face cover. It is important that you wear your face covering, but it's actually more important if you wear it correct, right? So, if you are wearing a pullover face gaiter face style, the ones kind of like what we issued out, please make sure you fold it. Again, I just kind of talked about that a minute ago. Make sure you kind of fold it in 2 layers. That way, you're getting the best, basically, bang for your buck, right? The best protection you can offer yourself. If you're wearing a non-surgical style mask or like the blue disposable ones you see all the time, or even an N95 style, they'll both be pictured here in just a minute. You must wear it so it completely covers your nose and goes all the way down to your chin with no gaps, kind of like what we just saw on a couple slides previous. And then here's that slide of the different masks or face covers, the gator style there, the blue non-surgical or the disposable, and then one style, the N95 mask there. When do I need to wear a face cover? So the CDC in the state of Michigan are actively advising people to wear their masks or their face covers anytime that they're in the general public or where anyone else can be present. Westmaas strongly suggests or strongly recommends that you follow their guidelines when it comes to that. The guidelines set by the CDC in the state of Michigan. But as an employee of Westmaas Electric, you are required to wear your face mask or face cover. Anytime you must break the social distancing rule, so within 6 foot of somebody for any duration of time. Anytime you are in the shop, and then also please remember that as of the beginning of December, the area or office areas in the shop are still off limits to field employees. If you need something, call in advance at least. Let us know you're going to be coming in. The shop's open no matter what, but I ask that you guys call it too as well. That way I can kind of keep a tally of who's coming into the shop and who's not. So certain job sites will require you to wear your masks or face covers all the time with no questions asked. And then other reasons can be added to this policy as this is an ongoing issue, so kind of keep that in the back of your head. Please note things are changing daily, and you may be asked to wear your face cover or mask at any point in time while you are working. You are also required to keep your mask or your face cover with you or on you at all times while you're working for us, so keep that in mind. Other PPE that can help reduce the spread of COVID-19. So, other PPE has been noted to be worn in conjunction with the face covering. So, basically, what they suggest as other PPE that can help slow the spread would be like your face shields, washing your hands, wearing eye protection, stuff like that. For more information on PPE options, go ahead and check the link out below, or just type in workplace and business on the CDC webpage, and that should pull some stuff up about COVID-19 and what else you can do. How do I notify the office of anything related to COVID-19? So kind of remember, notification is key. Please call, email, or use the note section in your JHA that you guys have been doing. That's that JHA/COVID screening questions you do every morning. Use those things to notify us of the following: any unsafe working conditions, so that could be COVID related or not. You or someone you are working with are exhibiting signs and symptoms of COVID-19. Close contacts or positive cases that you may have been involved with. So if you hear about it, see about it, you might not be considered a close contact, but at least get the ball rolling. Give us a heads up. Hey, my brother's sister's friend test positive, and we hung out with my sister all weekend. Okay, that's not necessarily a close contact for you. But at least it kind of gets the ball rolling just in case, oh no, you were in contact with them, now you're positive, and we can kind of go from there about maybe trying to get a hold of your close contacts. So use that. And then anything else related to COVID-19, any other concerns you may have, feel free to ask. I'm no professional with this at all, but I would definitely dig into your questions and see if I can find you an answer. I think most of you guys know that already. So what to do if you're sick, or what do you do if I'm sick? Um, Basically, all you guys know it's winter already, which means flu season, cold, stuffy noses, allergies, etc. You know, the whole 9 yards. So what do you do if you're sick? So if you're sick and you're exhibiting COVID-19 symptoms, you must quarantine for a minimum of 10 days from your first symptom. Remember that sentence. Keep that in mind. We're going to go back to that. Under the CDC and MyOSHA emergency rules, as an employer, we cannot allow you to work while you're sick, period. Even if you're sick with any other symptom. If you're sick, if it could be just a cold, whatever, actively kind of help each other out and be like, dude, you're sick, just go home, take a couple days, whatever. Um, if you're sick, you can get COVID-19 faster. So that's kind of what they're saying, at least. Again, I'm not a professional in it, I'm just going off of what they're saying. So we cannot let anyone sick work. So basically, if you're sick or exhibiting symptoms, you must quarantine for a minimum of 10 days from your first symptom. There's an asterisk there. Keep that in mind. We'll come back to that. Under the new CDC and MyOSHA emergency rules, as an employer, we cannot allow you to work while sick. So if you're walking around coughing up a storm, or you're exhibiting other symptoms that do not fall under the COVID-19 symptoms, as an employer, we cannot allow you to work. So help each other out on this too. I know it sucks. I know you guys want to be at work, but the best thing you can do is just stay home. So stay home if you're sick. Monitor your symptoms. Staying away from others is honestly the best thing you can do right now. So, like I said, help each other out. Let's go get through this together. Back to that asterisk. So please note the CDC is updating things daily. These guidelines are subject to change. As changes become available, we will update you as well. If you are sick, experiencing symptoms, or not experiencing symptoms, please call me immediately. We'll figure out the best plan for you. With that being said, yes, the CDC released a new update. It specifically says you need to ask your local county health department what they suggest you do. Unfortunately, our county health department and the county health departments around us are not adapting the 7-day rule. If you've looked at it, so if you hear anything about, well, I can only have to be off for 7 days, we're not doing that. Our counties around us and the counties that we work in are not allowing us to do that. So, ask me. I'll tell you the updated info. And this update is from December 10th of 2020. All right, reporting unsafe work conditions. So I'm going to get on a little soapbox here. We're talking about your guys' lives here. If I have to be the one where I have to go tell your wife, your significant other, your kid, whomever it may be, your family, hey, so and so died while he was doing X, Y, Z. It's stupid. It's dumb. Work smart, work safe. Take the extra time to get the better sized ladder or whatever it may be to suit your job. Wear the fall protection when you need to. It's common sense. So please, if you have questions about it, please get a hold of me. But report any sort of unsafe work conditions. If you're concerned about the site you're on, let me know. Report it. Um, Report it, call me, send me a text, email me. That note section in your JHA, the daily COVID screening, use that. Please know that if you are reporting any unsafe working conditions, it stays confidential. It stays between you and me. Speak now before someone you know or yourself gets hurt. You'd hate to look at that and go, that is really dumb, that is super unsafe. And 10 minutes later, now you're going, if I would have said something, they would have been okay. So come on, think about it, guys. We're working with life and death here. So please, please, please report these kind of things to me. That way we can kind of get a hang of it. So, all right. So contact and links. Most of you guys all have my contact by now, but if not, here it is. The office phone number, my cell phone number. I can receive text messages. Text me if you need something. My email. Link below, number 1, is going to be the MyOSHA emergency rules link. Click on that. It'll show you all the updated emergency rules for the state. if you work for a company that's governed by MIOSHA, which we are, we got to basically follow those to a T. They're all citable now. And then the CDC coronavirus link, that's basically the generic coronavirus link to anything that the CDC's been saying. So if you need them, they're there. If not, don't worry about it. And basically, that's the end of it, guys. Stay safe. Any questions, please feel free to contact me, and let's get back to work.